I'm Bobbi Fisher, and this is my Aesthetically Awkward podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. Welcome back to the show. Today we are going to talk about something I think every person in general, but especially in aesthetic medicine, has seen or felt at some point, whether it's online, in person, at an event, and that is mean girl energy. And I don't mean to make this pointed towards women, but I feel like cattiness and gossip, it comes a little more naturally to us. I'm going to be very clear up front. This episode isn't calling out someone specifically. It's about calling out a culture that hurts patients, that creates insecurity amongst providers, a culture that can make even the most compassionate practitioner question whether they fit in. We're going to talk about some real examples, including something that's happened to me at private trainings, a story from one of my patients who left another practice after overhearing some cruel comments, and the kind of judgment that happens at conferences and on social media. We're going to talk about what we can and should do differently. So let's focus first on the online side of things, because social media is where a lot of this behavior tends to become amplified. A few weeks ago, someone sent me a TikTok of an aesthetic provider who dressed up as a person who appeared to be overweight with exaggerated mannerisms, drawn on facial hair, like beard, mustache. The whole thing and the joke was essentially, if you're overweight and you're hairy, book an appointment with us. You need to come see us. And I don't think that she woke up intending to be cruel or to mock patients. I really don't. I think she was trying to be funny, trying to be relatable. Like, hey, if you have the symptom, I can help you. But shock value performs well on these platforms. It's what triggers the algorithm. It's what boosts views, boosts engagement. And I get that. She probably thought that people would understand it as humor. Your intent doesn't erase the impact. I knew the impact was real because I had a patient come in completely unprompted a few days after this, after I'd kind of written it off as just being, bad humor, didn't care, didn't dwell on it. But that patient came in and she said, "Hey, Bobbi, did you see this video?" She described it and I was like, "Yeah, actually I did see that." And she said, "Didn't you think it was disturbing? Disturbing that a healthcare professional would do that, would mock her patients?" She took it personally. So it made it very clear to me that it wasn't just me being sensitive. It's not a harmless joke. It actually hurt people. So that's something else that needs to be acknowledged. We've all posted things or cross-posted, reposted, shared memes online that we later realized probably didn't land the way we meant to. I'm not putting myself up on a pedestal here. I've definitely done it. Emotional growth is recognizing when something didn't align with who we are, and we adjust that to make sure that we show up in a better light moving forward. As licensed professionals, nurses, nurse practitioners, we're held to a different standard, though. We just are. Nurses specifically, we have a nursing code of ethics. It doesn't stop applying to you when you're outside of your clinic, outside of your practice. It doesn't magically turn off. There's no switch that's flipped when you're getting on TikTok or Instagram. We can't disrespect the dignity or the worth of the people we serve, even if it's by accident, even if it was unintentional. So that's what leads me to another example on social media that I've seen recently. It's an online fitness instructor, and they're saying, you wouldn't go to a fat provider for weight loss advice. Of course, that one got under my skin and it fired me up. If you know my story, if you know me in person, I'm not skinny by any means. You know that I've weighed 300 pounds, that I've lost the weight, regained it, I've battled PCOS, navigated infertility treatments, IVF, lots of hormone replacement therapy, insulin resistance. I've been every shape and size and flavor. My lived experiences, I feel like, have made me a better weight loss provider. At least that's what I've been told by patients. Thinness doesn't equal expertise, compassion, and it certainly does not automatically make you a qualified ethical provider. Shaming people is not how we should try to gain patients. I had a patient, come to me for a new consultation. She was actively on a GLP-1 that was being prescribed by a different provider, a different clinic. She said that the space that she was going to was stunning. The staff were all beautiful, well put together. Branding was stunning. Everything looked perfect. But something felt off. Their energy felt off. She always felt like she was being judged. Like she didn't look the part because she didn't look like them. She wasn't thin enough, polished enough. She didn't aesthetically align with who they were. She kept going because she wanted the medication. She wanted the results. She wanted to get healthy. She's got big events coming up and she wants to look her best. She told me that after her last visit, she paid and she never rescheduled. And then she found me and I asked her, why? Why didn't you reschedule? What made you decide to leave that practice? So she said that she went in for her visit. She did her weigh-in. She was roomed by, I'm assuming, the medical assistant. And she could hear the girls outside in the hallway talking about her specifically, saying, yeah, she weighed in at X pounds. She's on this dose and she hasn't lost any weight. And they were laughing about her, making fun of their patient and an earshot, no less. My gosh. She was embarrassed, humiliated. She paid for that visit, which is shocking. That's weight bias. And the fact that you can have such bias but still treat these patients and take their money is just insane to me. That is what mean girl energy and aesthetics looks like. Ethics certainly aren't there. That's why so many patients, women, are afraid to seek care. It's not because they don't want or need the help. It's because they're terrified of being talked about, judged, shamed, or mocked. You are breaking people's spirit. You're destroying trust between patients and providers. Aesthetic medicine tends to attract mean girl energy. It's not just online. It's not just, on social media, TikTok reels. It's not just inside the clinic too. I've seen it in trainings and conferences. I went to a private training with about 6 other people in the group. We're all nurse practitioners or registered nurse injectors. Training was led by a phenomenal nurse practitioner in the functional medicine and aesthetic space. Absolutely brilliant. She has an amazing framework. She's got great protocols. She's a mentor to other practitioners. She's someone with authority, somebody to be respected and trusted, somebody that people in our industry, in our niche, look up to. So she was giving us an example, talking about a GLP-1 protocol, talking about a weight loss patient, and she referred to that patient as Large Marge, like it was nothing. She just said it and moved on. It was a punchline for sure. A couple people giggled. It was like it was normal language for her to use, how she described this human being. I'm going to assume that she does not tell this patient that she's a large Marge to her face. If you're saying this in front of us, in front of a group of providers that you've never met before, I can only imagine how you're speaking with your team about your patients behind closed doors. That's the culture. That's what we are being trained to accept as the norm. That stayed with me. I have not been back for a training with that provider since, which is kind of heartbreaking because, again, she's got a lot of great trainings. This field, this specialty, there's a lot of cruelness and it can be very brutal, and it's not just to patients, but it can be to each other. If you're an aesthetic provider listening to this and you've ever attended a conference, make sure that you pack your best, not just your scrubs. It's not just about education there. It's a fashion show. Everyone is stunning. Everyone is perfectly put together from head to toe. Designer, everything. Beautiful clothes, beautiful hair, perfect polished makeup, not a lash out of place. It comes with pressure to fit in, to look the part, to match the aesthetic that not everyone naturally has. And if you don't, you feel it, or at least I felt it, because that's just not me. I have been told that I don't have the look. I've sat at a breakfast prior to a conference starting with a group of women that didn't know me, were introducing each other. And these conferences, they're not always providers. They're not always injectors. There's usually a mix of business as well. So lots of medical office assistants, front office staff, etc. And one of these girls was like, oh, I thought maybe you were a medical assistant. And she literally looked me up and down head to toe. I knew right then that I didn't belong at that table. She certainly didn't think I belonged either. This is the only place I've ever been, the only space I've ever worked in where my performance was directly related to my wardrobe. They don't care about my education, my skills, how much money I've invested into training, but they care about how I look. Again, this episode isn't about calling out individuals. It's about calling out the culture that surrounds aesthetic medicine. I'm not going to act like I have the power to shift the culture by myself, but I can tell you how I want to show up, how I want to be different. I don't want to participate in that culture of judgment. I try really hard, and sometimes I catch myself doing it. I try really hard not to be the provider who shares the images of celebrities and says, hey, what do you think she's had done? XYZ, the brow lift, the facelift, all the things. I don't want to pick apart other women, even the untouchable one percenters. It's about creating clinics and spaces where people feel safe, where patients can speak to you and they know that they're not going to be judged. They're going to get compassion. They're going to get education, obviously, but they're going to get compassion. It's about treating your colleagues with respect, even if they don't mirror you. Even if they don't look just like you, it takes all different types of people to create this space. I think it's also important to acknowledge that mean girl energy isn't just specifically within aesthetic medicine, although it does attract a lot of that energy. That judgment is not limited to aesthetics, and that's probably where a lot of us learned those behaviors. It shows up in every aspect of medicine, and I've been on the receiving end of it long before I ever put on scrubs myself. So before I was a nurse, before I went to nursing school, before I ever had a diagnosis of PCOS that told me what was wrong with my body, I went to my primary care provider telling her I was struggling with my weight and asking for help. At the time, I probably weighed around 250 pounds. I felt lost. I didn't recognize myself. I was actively hiding during family functions to make sure that nobody got a picture of me because I didn't want to be recorded. I wanted no documentation showing that I weighed that much. I didn't know that I had PCOS. I certainly didn't know what insulin resistance was. I didn't know anything about hormones or metabolic dysfunction. I just knew that I was miserable. I was swollen. I was fighting against myself, and I could not keep up with everything that was happening. I made that appointment with my primary care provider. That's the person that you're supposed to go to once a year or as needed and ask for help, right? They're supposed to help keep you healthy. That is their purpose that they serve in your healthcare journey. At the time, phentermine was the hot drug topic. It's what everybody was using for weight loss. I thought, there's some hope that's going to help me. I walked into that appointment very nervous, but very hopeful that there might be something that was going to help me lose this weight that I had gained. I didn't get any guidance, no curiosity, no workup at all, no labs, nothing. I just received judgment, and it wasn't subtle judgment. It was very overt, the kind that sticks with you. She didn't ask about my symptoms, didn't ask about my periods or my cycles, didn't ask about family history or anything that may have pointed her towards PCOS, hormonal imbalance, or dysfunction. She didn't ask about my eating habits specifically or my stress, what was going on at home or my relationship. She didn't ask about any changes in my life. She didn't ask if this was new weight gain or if it's something I've been struggling with my entire life. She looked at my chart. She looked at me. And within a few seconds, she already decided what was wrong with me. She told me I didn't need medication. I needed self-control. Like every other American who lives on cheeseburgers and French fries, I needed self-control. I needed to eat less and move more. I needed to get my butt up off the couch and go exercise. Without any real explanation, she told me, eat 900 calories a day, come back in 3 months. Ironically, she still prescribed me the phentermine with absolutely no guidance on how to use it, any discussion of risk benefits or alternatives, what to watch for, what it could do to my body. We'll talk about phentermine in a later episode, but we now know that there are better medications, safer medications to use. I just remember how I felt leaving that appointment. I was so embarrassed. I was so stunned and shell-shocked. It wasn't about the phentermine at that point. It was just about how dismissed I was, and about how ashamed I was. I didn't have the knowledge then that I have now. I didn't have the education. I didn't have the lived experiences. I didn't know any better. I didn't know that what she said was just rooted in bias, not medicine. That she just overlooked every sign of hormonal disorder or metabolic syndrome because she assumed I was overeating or lazy. While those things certainly did impact my physique, it wasn't the entire picture. That experience did change me. It helped shape the provider I am now. It made me aware of the way patients internalize comments, tone, facial expressions. It made me recognize how quickly shame can just shut somebody down entirely, how you can break a person. Judgment in medicine doesn't always sound like outright bullying. Sometimes it's delivered with a smile and packaged as advice, but it's still harmful. So the same kind of energy that we see in aesthetics when people mock symptoms that they don't understand or judge bodies that they've never lived in, that same mindset makes patients hesitate to ask for help because they're afraid they're going to be shamed for even asking, for even needing it, for ever getting to the point in their life where they had to ask the question. That's what gives me a front row seat to what it feels like to be dismissed by a provider who doesn't see you as a complex human being with real medical issues, just as a stereotype. That feeling is what so many women walk into our clinic carrying with them. That is deep-rooted shame. And it's not just aesthetics. The experience that I've had and so many patients have had isn't rare. The judgment shows up in many forms, in person, online, in a clinic, at a conference. Recognizing it, calling it out, making sure that we are doing our best to be part of the solution and not part of the problem. That's where our responsibility lies, regardless of the credentials behind your name. Whether it's a nurse, nurse practitioner, PA, physician, we all have a role to play. We all have that ethical responsibility. We're all here to serve our patients. As we wrap up today's episode, I think the biggest takeaway is that mean girl energy isn't a social media problem. It's not limited to aesthetics. It shows up in the way providers talk to and about their patients, about how we talk to our team, about how we perceive and talk about each other, and even the way that we talk about ourselves. It shows up in the most beautiful of spaces, in clinics that look polished on the outside, but make people feel small on the inside. It shows up in conversations that minimize real medical conditions because a patient doesn't fit a certain aesthetic. It matters because people remember how you made them feel long after they forget anything else. It matters because shame doesn't motivate anyone toward better health. It pushes them deeper into hiding. It matters because as providers, we set the tone. Our language, our energy, our professionalism, those things absolutely influence how our patients are going to be able to navigate their healthcare journey. If anything in this episode resonated with you, or if it reminded you of your own experiences, I hope it also reminds you that you deserve care rooted in respect and compassion. Whether you're a patient, a provider, or someone still finding their footing in this field, you deserve to feel like you belong. If you're enjoying the podcast, it would mean so much if you would take a moment to leave a rating or a review on whatever platform you're using to listen. It helps more people find these conversations. If you follow me on social media, feel free to send me a DM. Let us know what topics you'd like to cover in future episodes. Thanks for being here. Thanks for listening. And I will talk to you next week.